Okay, now we are going to discuss about nephrotic syndromes, right? So we have discussed about nephritic syndrome. Now we are going to discuss about nephrotic syndromes, right? In nephrotic syndrome, first topic we are going to discuss is minimal change disease, MCD. So first topic we are going to discuss is the minimal change disease. Minimal change disease, right? We all know that this is the most common cause of nephrotic syndrome in pediatric age group, right? So this is the most common cause of nephrotic syndrome in pediatric age group, as we have discussed earlier also. So what is the etiopathogenesis of nephrotic syndrome? Nephrotic syndrome can be due to respiratory infections, right? So this can be secondary to respiratory infection. This can be secondary to immunization in pediatric age group. So we should ask history of immunization, right? So respiratory infection, immunization, and it can occur secondary to the lymphomas also. So when there is a lymphoma or leukemia, remember, when there is a lymphoma or leukemia, that time also we have to keep that in mind. In case of lymphoma or leukemia, what is the most common glomerular pathology, right? So remember, in case of lymphoma or leukemia, most common glomerular pathology is minimal change disease, right? So that can be a future question also. That is why I wanted to write. So leukemia, lymphoma, they are most commonly associated with which glomerular pathology? Minimal change disease, right? So respiratory infection, immunization, lymphoma, leukemia, all these are associated with minimal change predisposition or etiologies. How? Means what is the pathology? Pathology is because of all these things, right? So because of all these events, there will be immunological reactions, right? So what I want to say that there will be some certain type of immunological reactions, and due to immunological reactions, inflammatory cells will be accumulated and there will be release of the cytokine, right? So there will be release or there will be increase in cytokine secretion. So immunological reactions giving more cytokines, and what will happen after that? So because of this increase in cytokine, what will happen? This cytokine will be having two effects. Number one is they will damage visceral epithelial cells, and second, this will result in loss of polyanion on basement membrane, right? So there will be loss of polyanion on the basement membrane. So because of the cytokine released by inflammatory cells or because of the immunological reactions, patient will be having damage of the visceral epithelial cells, right? And because of the damage of the visceral epithelial cells, we all know that visceral epithelial cells are having foot-like processes, right? So they are having foot-like processes like this. So these are the normal visceral epithelial cells, right? Because of damage, what will happen? The cytoskeletal protein present in this cell will be damaged and they will collapse. Because of this collapse, now they will be acquiring shape like this, right? So that is why it is called as fusion of food process or effacement of food process of the podocyte, right? Or effacement of the podocyte. So that is why it is called as fusion of the food process or effacement of the visceral epithelial cell. Fusion or effacement of the visceral epithelial cells. So fusion of food process of the visceral epithelial cells, right? So fusion of food process of the visceral epithelial cells or effacement of visceral epithelial cell. So nowadays it is more precise to be said effacement of visceral epithelial cell, right? So now we can see what is the etiopathogenesis of the minimal change disease. Because of the immunological reaction, cytokines are released, they will damage the visceral epithelial cell, they will have effacement of visceral epithelial cells. So that is the important MCQ which examiner asks, effacement of visceral epithelial cells. In older time they used to use term fusion of the food process, right? Because of loss of ion on the basement membrane, because this polyanion is like a repulsive force for negatively charged albumin, right? So because of this loss of polyanion, there will be proteinuria, right? Or you can say albuminuria. So that is why these patients will be having proteinuria. So this proteinuria is because of this thing. So we can understand what is the basic etiopathogenesis of the minimal change disease, right? So there is a damage of the visceral epithelial cell, there will be fusion of the food process, and second thing, there will be loss of iron on the basement membrane. That is why there will be loss of negatively charged albumin, and that will result in proteinuria, right? So these are the important point about etiopathogenesis. In this patient, when you will see the clinical feature, usually these are pediatric patient, 2 to 6 years of age group, and most common presentation is the massive proteinuria. So most common presentation is massive proteinuria, right? So most common presentation is massive proteinuria, right? And this proteinuria is selective proteinuria. So as I have discussed earlier, what are the selective and non-selective? So this will be selective proteinuria, right? So they will be having massive selective proteinuria in case of minimal change disease. There will be no history of the hypertension or hematuria, right? So here we must understand that there will be no hypertension or hematuria will be seen in these patients. So no hypertension or hematuria will be seen in this patient, right? When we start seeing their light microscopy, right? Light microscopy and their immunofluorescence microscopy, both things, when you will observe, both will be having none of the features which can give diagnosis of the minimal change disease, right? So what I want to say that they are non-diagnostic. So light microscopy, immunofluorescence microscopy, they are non-diagnostic, right? So they are non-diagnostic. Minimal change disease, they are also known as lipoid nephrosis, right? Minimal change disease, they are also known as lipoid nephrosis. This is another name, lipoid nephrosis. So this point also we have to keep in mind. Lipoid nephrosis is another name of minimal change disease. Why it is called as lipoid nephrosis? Because on light microscopic examination, when you will see the tubules are having lipid inclusions. So they will be having lipid deposits, and that is why it is called as lipoid. So because of the presence of the lipid in tubules on light microscopic examination, that is why they are also called as lipoid nephrosis, right? So this point we must understand. Lipid are present inside the tubules, and that is the one finding, not a diagnostic finding, right? Remember? So that is why I wanted to tell in the beginning itself, light microscopy, immunofluorescence, non-diagnostic. Only one finding you will find, light microscopy, tubules will be having lipid deposits, right? That's all. On electron microscopy, so here what we should understand, electron microscopy is only diagnostic. That's all. Only electron microscopic is diagnostic for minimal change disease, right? So what will be that finding on electron microscopy? So again I will draw the capillary and the same structure which we have seen earlier, right? So suppose I am drawing a capillary here. This is the capillary, right? And lumen is lined by endothelium. Already we have discussed endothelial lining, right? So these are endothelial lining, and outside there are mesangial cells, right? So these are mesangial cells in mesangial matrix, right? And they are covered by the basement membrane. So this is the basement membrane, and again they are covered by the podocytes. So these are podocytes, are also known as visceral epithelial cell. So that is the electron microscopic view of the minimal change disease. What we are going to observe, as I have told you, because of the cytokine, there will be damage of the cytoskeletal proteins, right? So because of the immunological reaction, cytokines will be released. They will damage the cytoskeletal protein of the visceral epithelial cells. So as a result, what will happen? They will have effacement of the food process. So this is called effacement, right? So only one finding which you will see is the effacement of food processes of visceral epithelial cell, right? So this is the diagnostic finding on electron microscopy of minimal change disease. So effacement is the terminology which we prefer to use nowadays, and used in All India exam 2016. So that is why I wanted to tell here कि name is minimal change disease. Minimum change. What is that minimum change? Effacement of food process of the visceral epithelial cells only. That's all. No problem. Light microscopy, normal. No immune complex deposition on the immunofluorescence microscopy. So that is why this disorder is named as a minimal change disease, because only electron microscopy showing one diagnostic finding, that is effacement of the food process of the visceral epithelial cell. What about the basement membrane? Minimal change. See the name, minimal change disease. Basement membrane is normal and intact. So here we must understand, in case of the minimal change disease, basement membrane is normal and intact. Only they will be having loss of iron, because of which there is a proteinuria, right? So here again I would like to tell you some differentials of the effacement of the food process of the epithelial, visceral epithelial cell. So this was the question in PGI exam 2011, right? Question was, what are the differential for the effacement of the food process of the visceral epithelial cells? So differential for the this effacement of the food process of the visceral epithelial cell, one we are seeing is the minimal change disease, right? Apart from this, it can be seen in membranous glomerulonephritis, it can be seen in FSGS also, it can be seen in MPGN also, right? So these are all examples of the effacement of the food process, fusion of the food process, right? But here what we have to be very clear during exam time, whenever examiner says that the effacement of food process is there in which of the following, so all of the following. But once examiner starts saying that the basement membrane is normal, that's all. Only and only minimal change disease will be having normal basement membrane. So only minimal change disease will be having normal basement membrane. Membranous, FSGS, MPGN, they all will be having basement membrane damage. So basement membrane damage will be present in all of them. Membranous, FSGS, MPGN, all will be having, right? Here I would like to show you electron microscopy of the minimal change disease, right? So in minimal change disease, as I said, only electron microscopy is diagnostic. So it is important to understand electron microscopy. You can see the lumen here, I am showing you, right? So this is entire lumen, and you can see the basement membrane here. Can you see this? This is entire thing is the basement membrane, and outside the basement membrane you can see there is a podocyte. Can you see? This is the podocyte, and you can see in this podocyte all the food processes are diminished, or you can say effacement. So this is called effacement of the food process, effacement of the food process of the visceral epithelial cell, which is also known as fusion of the food process. So that will be the only finding. Otherwise, basement membrane is continuous. There is no rupture in the basement membrane, and that is how we will diagnose a minimal change disease.